We are joined by Jay Fox from the Ohio News Network. So, a new economic analysis coming out of the Commonwealth Fund came out yesterday morning, and it underscores the economic impact of some of the federal funding cuts. We've seen these federal funding cuts come to food assistance, Medicaid, and really in the long term, this could have an effect on some of Ohio's development and growth. Looking into this study, what did we find out of that?
Well, on page 1, it looks great. And then on page 452, it doesn't look so great for Ohio. And that's where we get into the fine print. So the report states that Medicaid and food assistance cuts will cost the Buckeye State over 50,000 jobs and will remove $5.3 billion from the state's gross domestic product by 2029. Now, Bryn, Colin,
what?
You remember economics, right?
It's been a bit.
Yeah. I slept through it, so I had to go back and look. What is the gross domestic product? That is total monetary value of all finished goods and services within our Ohio borders. That includes consumer spending, business investment, government spending, and the net total value of exports minus imports.
Okay,
Right, yeah,
so
your net versus your gross.
Who is the Commonwealth?
I had to look that one
Yeah.
up too. So they are one of the oldest nonpartisan private foundations. So anytime you see a study like this, you always want to ask the question, who's writing the study? Who's doing the research? Who's funding it? Are they from the right group, the left group, the centrist group? This is a nonpartisan group, and they date all the way back to 1918. So I wanted to know how they do this. They track state-level medical expenditures from the U.S. Department of Agriculture and estimates from the Congressional Budget Office using an economic modeling program. And what that program did is it forecast the impact that the cuts will have specifically on our Ohio economy.
And looking at some of those numbers of the cuts of this study, Ohio faces some pretty staggering losses.
It does. $4.4 billion in federal funding, lowered business and personal incomes. That's going to remove $368 million from state and local tax collections. And as we know from looking at all of the school districts and all of the other issues regarding city budgets across the state of Ohio, that tax collection money is imperative to maintain public services. Ohio, compared to all the other states in the union, will suffer the 8th highest volume of job losses in the country.
So when it comes to those jobs, what kind of jobs are we talking that we could stand to lose?
The one that gets hit the hardest is the healthcare industry, more than 51,000 jobs. That will impact workers at hospitals, clinics, pharmacies, and nursing homes. And sadly, rural Ohio will suffer the most because they will see an estimated $5.62 billion drop in Medicaid funding over the next 10 years. Cuts to SNAP will also hurt grocery stores, farms, and local food producers. And here's where it gets really interesting. You guys have heard about all of the work requirements to keep Medicaid and SNAP.
Mm-hmm.
So imagine you have a down job market and now you have all of these requirements to work. How are the people who have to work going to find jobs if all these jobs are going away? It's a dichotomy with no answer.
Mm-hmm.
Where can people go read this for themselves?
So we found this on commonwealth.org, and it's in the publication section. And I'll tell you, it's fascinating, it's disturbing, but what I wanted to know next is anyone challenging the findings of the report? And so far, no one is challenging the logistics, no one is challenging the methodology, no one is challenging the results. However, lawmakers are ardently defending all of the elements of the One Big Beautiful Act, saying that the net result of the bill will outweigh any of these losses.
Right. And, you bring up the healthcare losses because that has been one point that especially rural hospitals have raised is that because rural hospitals are largely supported by Medicare, Medicaid funding.
That's exactly right.
And a lot of rural healthcare systems have raised the red flag and said, we could close.
Oh, without a doubt. I mean, you got to think about it.
State universities as
right,
well.
Logically.
Yeah.
So I'm a rural hospital. Now my
hospitals.
patient load has gone down. I've lost doctors and nurses, and I've lost funding on top of that. The decision is going to be made. Where's the nearest hospital?
Yeah.
Can we afford to shut down? And that really unfairly punishes people in rural areas because, you got to think about, the distance between the rural area to the big city. It could be as much as an hour and a half.
Right. I mean,
look at like Delaware County now. It takes like 40 minutes, 45 with traffic to get out
Well,
there.
and I
From
mean,
like, you know what I mean?
even
It's
to
that,
go-
that
far.
Grady Memorial story with the maternity ward. Well, that's not this.
Right.
It's an indication of what could come.
right. And I mean, I guess, you take it outside of even the metro of Delaware, because I would at this point consider Delaware almost urban at this point.
They don't want to hear that,
They
Colin.
don't.
Colin,
They
they do
don't.
not want to hear
They
that.
don't.
There's parts
But
of
look
it
how
that
big you are, Delaware.
Yeah.
You have to come to
when
reason with that at some
23
point.
gets done, then they can. Yeah, exactly.
But Delaware has access to services. Take a look at, maybe Mechanicsburg,
Yes.
for example,
Good old-
that is really removed from the Columbus, what do you call that, metropolitan area.
I'll give you one better.
Yeah.
Leestat Township.
Yeah.
Leestat Township in southeast Ohio, where they're building the brand new nuclear power plant in Meigs County. Where's the nearest hospital for those people?
I guess a good time to get into the hospital business.
Perhaps. Or a good time to win the lottery.
Absolutely. All right, Jay Fox, thank you so much.
Thanks,
we appreciate
gang.
you coming on today.